Welcome to Nursing Insights. Test your knowledge with 25 essential nursing questions. Let's see how much you know. A patient with a chest tube following thoracic surgery asks why the tube is necessary. Answer: C. It removes air and fluid from your chest to help your lung re-expand. Chest tubes are used to remove air and fluid from the pleural space, allowing the lung to fully re-expand following surgery or injury. A nurse is caring for a patient on long-term opioid therapy for chronic pain. What is the most important assessment for this patient? Answer: A. Monitor for signs of respiratory depression. Opioids can depress the respiratory system, especially in long-term use, so monitoring for respiratory depression is critical. A patient with atrial fibrillation is on anticoagulation therapy. What is the priority nursing intervention? Answer: B. Monitor for signs of bleeding, including bruising and hematuria. Anticoagulation therapy increases the risk of bleeding, so the nurse must closely monitor for any signs of bleeding. A nurse is caring for a patient with severe burns, which is the primary focus during the emergent phase of burn care. Answer: C. Fluid resuscitation. The emergent phase of burn care focuses on fluid resuscitation to prevent hypovolemic shock, a life-threatening complication of severe burns. A patient presents with bradycardia and hypotension after a spinal cord injury. What condition should the nurse suspect? Answer: B. Neurogenic shock. Bradycardia and hypotension following spinal cord injury suggest neurogenic shock, a condition caused by the disruption of autonomic pathways. A nurse is taking a manual blood pressure and hears the first clear tapping sound. What does this indicate? Answer: A. Systolic pressure. The first sound heard during a manual blood pressure reading is the systolic pressure, which indicates the pressure in the arteries when the heart beats. A patient with diabetes asks why they need to rotate insulin injection sites. What is the best response? Answer: A. To prevent skin damage or fat buildup. Rotating injection sites helps prevent lipodystrophy, where fat can build up or break down, affecting insulin absorption. How often should a peripheral IV site be checked for signs of infection or infiltration? Answer: C. Every 4 hours. Regular monitoring of IV sites, at least every 4 hours, helps detect complications early, such as infection or infiltration. A nurse checks a patient's blood pressure and it reads 160/95 millimeters of mercury. What should the nurse do next? Answer: B. Recheck the blood pressure in a few minutes to confirm. It's important to recheck an elevated blood pressure reading to confirm accuracy before deciding on further action. What is the primary purpose of using a pulse oximeter? Answer: C. To measure oxygen saturation in the blood. A pulse oximeter measures the percentage of oxygen in the blood, which is vital for assessing respiratory function. A patient has an order for NPO after midnight before surgery. What does NPO mean? Answer B. Nothing by mouth, NPO, stands for nil per os, meaning nothing by mouth, to prepare the patient for surgery and avoid aspiration during anesthesia. A nurse is assessing a patient's radial pulse. Where should they palpate for the radial pulse? Answer C. On the wrist. The radial pulse is located on the thumb side of the wrist and is commonly used to check heart rate. A nurse finds a patient confused and agitated. What is the first action? Answer A. Reorient the patient and ensure safety. The nurse should attempt to reorient the patient and ensure their safety before considering other interventions. Why is it important to use a gait belt when transferring a patient? Answer B. To provide support and control during transfers. A gait belt offers support and stability when transferring or assisting a patient with walking, reducing the risk of injury. When administering oral medications, what is the best way to ensure the right patient receives the medication? Answer A. Verify the patient's identity using two identifiers. Using two identifiers, such as the patient's name and date of birth, ensures that the correct patient receives the medication. A patient taking digoxin should have their pulse checked before administration, and the medication should be held if the pulse is below 60 beats per minute. It's true. Digoxin can slow heart rate, so checking the pulse is crucial. If it's below 60 beats per minute, the drug may need to be withheld to avoid bradycardia. Heparin and warfarin can be given together to manage anticoagulation because they work on different parts of the clotting cascade. It's true heparin is fast-acting and used acutely, while warfarin takes several days to achieve its effect. They are often overlapped in treatment. A nurse should administer morphine intravenously over 1 to 2 seconds to provide fast pain relief. It's false. Morphine should be administered slowly over 4 or 5 minutes to avoid serious side effects like respiratory depression and hypotension. In a patient with asthma, beta blockers like propranolol can be used safely without concerns for side effects. It's false. Non-selective beta blockers like propranolol can cause bronchoconstriction, which may exacerbate asthma symptoms. Patients on long-term corticosteroid therapy are at risk for developing adrenal insufficiency if the medication is abruptly stopped. It's true. Long-term corticosteroid use suppresses the adrenal glands, and abrupt withdrawal can lead to adrenal insufficiency. Nitroglycerin patches can be worn continuously, 24 hours a day, for consistent relief of chest pain. It's false. Nitroglycerin patches should be removed after 12 to 14 hours to prevent tolerance, allowing a nitrate-free interval to maintain effectiveness. Patients taking metformin should avoid alcohol to reduce the risk of lactic acidosis. It's true. Alcohol increases the risk of lactic acidosis, a rare but serious side effect of metformin, particularly in patients with kidney issues. Aspirin can be used in children with viral infections to reduce fever and pain. It's false. Aspirin should not be used in children with viral infections due to the risk of Reye's syndrome, a rare but serious condition. Furosemide, Lasix, is a potassium-sparing diuretic used to treat hypertension and edema. It's false. Furosemide is a loop diuretic, not potassium-sparing. It can cause significant potassium loss, requiring careful monitoring. Patients receiving chemotherapy should avoid live vaccines due to their immunocompromised state. It's true. Live vaccines can cause infections in immunocompromised individuals, such as those receiving chemotherapy. Great job on completing the nursing quiz. How did you do? Don't forget to like, share, and subscribe for more quizzes that keep your skills sharp. Thanks for playing, and keep up the amazing work in your nursing journey.